Well, good morning, everybody. Thanks for joining us today. I'm Brooke Lovelace. I'm the Executive Director of the Iowa Developmental Disabilities Council. We've got a lot to cover here today, but we appreciate you joining us on this beautiful Friday. With that, I think I'm just going to go ahead and turn it over to you, Amy.
All right. Well, welcome everybody. Happy holiday weekend, or however you celebrate it. I just wanted to do a quick level set on where we're at with the session. Things are going to move slow and fast. That seems to be a contradiction, but the days are quite long and a lot of waiting for things to happen. But when they do happen, they happen very quickly. We're now at the last few weeks of session. There's just over 2 weeks of paid time left at the Capitol. So you can see we've passed the second funnel since we last met, and we are now moving toward that final day of session where their pay stops. So they won't get their per diems. So they'll have to pay for hotels and mileage and all of that on their own after that. So they can go longer. They just don't get paid for staying in Des Moines when they're here. So it looks like, with all indications of what's going on, like we are going to be wrapping up right around that date. I would expect it to be within that week or another week after that. I say that, and then something could happen and all deals are off and they stay longer, but they are seeming to be moving forward. And one of the big signs is today, just a few minutes before this started, we got the budget targets for the House and the Senate. And that's the first part of budgeting, is when legislative leaders, the House Speaker of the House and the Majority Leader in the Senate, come up with their budget target. That's an overall amount that they want to spend in budgets. And so they just announced that, and you can kind of see the numbers here. Again, this will be posted on our website, the slides, and this information will come out in our newsletter this weekend. But you can see that the House and the governor are pretty close together. You know, about $400,000 more than the current $400 million more than the current year's budget. There, the House is slightly higher than the governor. The Senate is lower, as you can see. And then I threw in the 99% limit. We are allowed in Iowa to spend 99% of the revenues that come in. So of all the taxes and all the money the state collects, the legislature is allowed to spend 99% of that. That is the 99% limit, rounded. I'm sure there's some additional numbers on that, but you can see we're spending almost $1 billion less than what we could. So I put that money in there because I know many of you, when you talk to your legislators here, well, we just don't have the money. We don't have the money to buy down the waiver waiting list. We don't have the money to increase pay to providers. They have the money. They choose not to spend it on those items. Instead, that money will go into a taxpayer relief fund, which is over $5 billion now, for future tax cuts. So that is how they're choosing to spend the additional dollars, rather than spend it on things like provider rate increases or additional services or extending postpartum coverage for pregnant women. That is how they're choosing to spend those dollars. So I wanted to note that, so that when somebody does tell you they don't have the money, you know there is $1 billion sitting there that is unspent and could be spent should they choose to do so. I should stop there. Does anybody have any questions about that? Because I do have a little bit more detail on how the House is breaking out their budget targets, but I don't on the Senate side. So if I don't get those today, you'll have that information in the newsletter this weekend. I know that the House plans, I'm looking at the document, to spend an additional $92.4 million in health and human services. I'm sure a lot of that goes into the Medicaid budget, but I don't really have any more detail on that. That's the next step, is they will divide these up into each of the 9 budget subcommittees, and then they can decide how to spend all of that money. So that's the next step. I'll pause here quickly. We'll have time at the end too if you think of things. I don't see any hands or. Okay. I wanted to let you know that there were a couple new bills. So new bills keep getting introduced in the House Ways and Means Committee or in the Appropriations Committee, not House or Senate Ways and Means Committee or Senate and House Appropriations Committee. So we have 3 new bills. They're really ones that 2 are really ones you've seen before. The newest one is this easy healthcare enrollment. It is House Study Bill 741, and it's a system that allows people to check a box on their tax returns, so that gives the Department of Revenue permission to send that to Medicaid so that they can check to see if you're eligible for any of the programs that health insurance programs they offer, or the exchange. So it's apparently something that's been done in other states and is really easy for people that are uninsured to figure out if they qualify for any of the state programs or federal assistance for the exchange programs. It did pass subcommittee, but it's still in the House Ways and Means Committee. So we'll find out next week if that is on the calendar for their meetings next week. They'll have 2 Ways and Means meetings next week on that. But the chairperson of that subcommittee is Representative Bobby Kaufman, and he also happens to chair the committee. So if he passed it out of subcommittee, I would guess he would be passing it out of the full committee. The other one is Medicaid prior authorization, House Study Bill 743. This has been a priority for a lot of providers who often get prior authorized to provide a service, and then the MCO or Medicaid comes back and tells them, oops, they weren't eligible after all. You shouldn't have been paid for that. Give us our money back. That is something that won't be allowed to happen under this. So if a person has prior authorization from the MCOs or the fee-for-service system with Medicaid, and they get that prior authorization, then they would be paid 100% and would not have their money taken back. One example was a doctor got prior authorization from an MCO to replace a knee, and then did that replacement, and then was told, oh, oops, that person shouldn't have been prior authorized, and they wanted the money back. It's like, you gonna take the knee back? So that was one example that one of the medical society talked about. There is a subcommittee on that bill on Tuesday at 12:30. And there's also a subcommittee on the following bill at noon, just before that. So they're back to back on complex rehab technology repairs. So we talked a lot about the right to repair. It got added to the work without worry bill. There were 2 separate bills addressing repairs of complex rehabilitation technology. And they did not go anywhere, haven't moved. And so this bill, they're trying to revive that issue, stating that MCOs and Medicaid's fee-for-service system can't require a prescription or require somebody to go see a provider face-to-face in order to get a reimbursed for repairs to those complex rehabilitation technologies, primarily used for to improve mobility. So I think they're trying to get out the wheelchairs and that type of technology that helps people with their mobility. You would still have to require prior authorization, but would not need the additional prescription and getting an appointment with a provider that you may or may not be able to get to because your technology won't allow you to move. So that prior authorization, a lot of the MCOs talked about how sometimes it's just, instead of repairing something, it's cheaper to replace it. And so that is why they want to maintain the prior authorization, so that if it's an older piece of technology, it might be time to just go ahead and replace it rather than continually fix it. So those were 3 new bills that came out this week. We will continue to see a few coming out, but wanted to make note of those. Any questions on those before I go on? Okay, and those people listed are the subcommittee members, so they are people that are good people to talk to about these bills, because they're the ones that'll make the first decision on whether to move it forward. And then the Ways and Means Committee, full committee, will be the second group of people. I just kind of wanted to give you a little status update on where everything's at, on some of the things that we've been watching. The items in red are actually subjects of our bill of the week. So if you haven't looked at those on our website, we have all of them still listed. It's a 1-pager on each of these bills that we kind of highlight for the week. And so there were quite a few of our bills of the week that are still alive. You can see that the guardianship bill has been sent to the governor. It was sent quite a while ago. I don't know why it hasn't been signed yet, but I do anticipate that it will get signed here pretty soon. And then, of course, probably everybody has heard about the AEA bill getting signed into law the day after it passed the Senate. So I have another slide on that as well. We still have some bills that are on the calendar in the Senate. I kind of mentioned there were a lot of bills sitting on the Senate calendar. There's about 130 bills on the Senate calendar versus 50 on the House. So not many things left out there. That sounds like a lot, but it's really not for this time of the year. So there are still quite a few bills that the Senate needs to take action on that you can see there. And then I wanted to note that the behavioral health district bill, the big HHS bill that reorganizes the MHDS regions into 7 behavioral health districts and moves disability services over to the Aging and Disability Resource Center network. They have new bill numbers. They were amended in committee, and then the amendment was incorporated into the bill. So it's a clean bill. You don't have an amendment to it that you can read. And that is those Senate File 2354 and House File 2673 should not be renumbered again. So that should be the final numbers that you see there. So those bills are all really ready for, if the Senate votes on those bills that are under that listing, they'll go to the governor if they don't amend them. And then we still have a few bills that are in committee. There's been no movement on right to work or work without worry and right to repair. And the ABLE savings account tax deduction is still in the Senate Ways and Means Committee. It passed the House, but it is in that committee. And so those were just some of the things I know all of you have been tracking. Does anybody have any questions on those? I do have, I think I have a slide on the AEA reform that I can switch to, but I will say that Senate File 2268 is our bill of the week this week. It is on our website now on assistance and service animal restrictions. And we did a snapshot that I'll show you at the end if we have time with Heather Matson, Representative Heather Matson from Ankeny. She worked with Representative Turek to fix that bill. So that's why it has an amendment over in the Senate that they need to approve, but it separated out assistance and service animals and some of the requirements of what a landlord can include in a lease or a requirement in order to have an accommodation for a service or assistance animal. The original bill treated them the same, and that did not align with federal housing law. So she and Representative Turek were able to get that that changed and sent back to the House. So it does add more clarity on what a landlord can request from somebody to make an accommodation, and it should be aligned with federal housing law. Our existing law was a little confusing, I guess I would say. Sorry, I interrupted somebody.
It was just me, Amy. I was just saying we have a quiet group today.
Yes, I think we're all feeling that right now, right? We can go back. I just wanted to know what finally ended up in the AEA package. There is going to be a new special education department in Department of Education. There will be 13 employees in the central office in Des Moines. They will put 40 of the Department of Education employees into the AEA offices around the state. And rather than say there'll be an equal number in each one, they're going to base it on what each AEA needs. And then each AEA, there are 9, will have 1 employee of the department acting as the special education director. They did continue to cap AEA administrator pay at 125% of what the average a superintendent makes in the region. And I believe that change will go into effect when they have new contracts negotiated. I would guess that's going to be a significantly lower amount for a lot of these folks that maybe don't have an urban center that has higher superintendent pay, bringing up that average. The funding piece, which I know has been of interest to a lot of you, there will be no change in the first year. So this year starting, for the school year starting this fall, there will be no changes in special education funding, which is about $185 million according to the fiscal note, of funding that is currently going to the AEAs. And then also they provide media and general education funding. So they do split that out in the first year where 60% goes to the schools and 40% to the AEAs. This is a lot of the shared services. So like media packs that they have, like if you have a volcano lab in a science class, they might have a pack of materials you can rent from the AEA or use from the AEA. That's what those media type of services are. And so they would go to 60% would be fee for service. So they could either keep it or they could contract with the AEA. In the second year, so starting in the fall of 2025, next year, AEAs would get 90% of the special education funding, and schools would retain 10%. That remaining 10% could be fee for service with the AEA, or they could use it on their own to pay for their costs or to contract with somebody else. And then 100% of those other funds go to that. The special education department will take over decision making on what types of professional education development can be performed. And then they did include school funding, overall school funding, so a 2.5% increase in allowed growth, $14 million for paraeducators and other classroom support staff wages. The earlier versions had said that they need to have, it would have required a $15 minimum salary. I did not quite understand the rationale of why they didn't include that, other than they said it was too hard to figure out. So they just put in 14 million. The minimum the minimum beginning teacher pay starts off now at 47,500, which is now 33,000, I think, somewhere in that range. And then in the following year, it would go up to 50,000. Oh, 33,500. I did write that in there. So it's a significant jump in beginning teacher pay and would put us at 5th in the nation once we get up to 50,000 in 2025. They also increased the experienced teacher pay from immediately at 60,000 and then $62,000 when you had at least 12 years in the classroom. So rewarding those teachers that have been there for a while. So I will stop there for a second. We had a question from Jordan True on, does anyone know why Iowa HHS, On With Life, Child Serve, Iowa Total Killer Relevance Health, and Cedar Rapids Metro Economic Alliance are undecided on Work Without Worry? I don't know. Most people stay undecided for a long time. I know lobbyists do register undecided on bills until they can get information back from their clients, or their clients may just think if it's going to move, we'll take a position on it, but until it moves, we'll just stay undecided. Or they might have questions about it. I don't know if anybody on here is from one of those organizations that might want to say something. I can try to find out more information, but I don't know about the Economic Alliance. I mean, I know Total Care and Elevance will never take a position against Medicaid because they are Medicaid. So whatever Medicaid instructs them to do is what they will do. So, and usually if it's not in the governor's budget and it's not a governor's bill, the department won't register on it unless they get permission. So I can try to find out more from the others though. I do think that becomes the list of people you go after in the summer to try to get this. It's a big shift in philosophy, Work Without Worry, not philosophy, but it's a big shift. And sometimes that takes a while to get legislators and others on board with it. So this is the second year that's been introduced. And sometimes it can take 5 years before things really start moving. Go on to the next one. Let's see any other chat questions. So we talked about the new bill numbers on the behavioral health one, and you can just see it. Not a lot has changed. Most of the changes are in the timeline. I should say not a lot. It was a 36-page change, but a lot of the changes were cleanup language. But there were quite a bit of things that address concerns that people have brought to the department. So we still don't know the maps, but they did kind of create more inclusive language. They moved up the timeline. So July 1, we will see the initial transition plan, and there will be public input into that plan. It is required in the bill. They will finalize the maps. So this is a draft map that you see, but they will finalize that map on August 1st. The administrative services organizations that will manage the services in each of those districts will be selected by December 31st. And then they will have 6 months to get the new system in place, including contracts and everything else. One thing that people wanted to make sure is that the people running these services are nonprofit or government agencies. So specifically for-profit organizations like an MCO that's a for-profit company could not come in and run those services. They added a child mental health advocate and law enforcement to the regional advisory, district advisory boards. And that was specifically because people were concerned that there was not enough mention of children in the system and thought they would be forgotten. I did want to make one comment There is language in there that says that disability funding for disability services will be ended on July 1, 2028. That is because there is an anticipation that the money for disability funding will eventually come out from under the behavioral health side and be moved over to the aging and disability network. So right now, they don't know how much is being spent on disability versus mental health. So they will be tracking that so that they can come up with a funding recommendation that would have the funding stream on one side for disability and the funding stream for the behavioral health and addiction services on the other side. So didn't want anyone to see that and get worried and think, well, how's it going to be funded after that? There is a plan to continue funding. It's just they needed to have time to be able to sort it out and know how much is actually being spent by the regions on those types of services. I do anticipate this is going to pass. I've heard concerns just because of the unknown of what it's going to look like moving forward. But I have also heard concerns that people are concerned about allowing HHS to take 5% for administration off the top of the behavioral health fund, which they do not have access to the MHDS regions administration funds right now. But I think most of it, the concerns that I really hear are about the map, who's going to go with who. It's hard to merge 13 regions that have been working together for a decade and now have them kind of have to reshuffle again. Any questions about the behavioral health bill? I just did this because I thought maybe people might want to talk about other stuff. I have a few other things I can go to, but I thought I'd just pause here to see if anyone wants to talk about anything on your minds. Or if Carlin has any additional things she wants to share, or Brooke from the DD Council perspective. We are a quiet group today. It's okay.
Amy, I can make a comment. Maybe it'll get people thinking. So when we're talking about some of the bills that have passed, especially the AEA bill, there have been a lot of questions that have come up about how it's going to affect schools and AEAs since its passing. And some advocates have been discussing what some of the fallout could be and have a lot of questions. And so, we're encouraging them and you to reach out to your legislators to ask those questions, because they should know what was in the bill. If they don't, then that tells you something, but that also may lead you to who can answer some of those questions. But it's giving them a chance to educate lawmakers. Some teachers have looked at the bill closely and pointed out some of the ramifications from even the increase in teacher pay that could, have some maybe detrimental effects on some other teachers. So they're reaching out to their legislators and letting them know that. So I encourage you to do that, because it's educational for those who are working on these policies and moving them through quickly. And sometimes we don't see the unintended consequences until everybody sits down and looks at it when it's done and takes a hard look, and then find some things that maybe were intended but maybe were not intended. So feel free to question always after something passes and you have questions.
Yeah, we didn't have any we tried to get a couple guest speakers today, and we're unable to do that because of it's Good Friday and a lot of people are celebrating. the Easter weekend with family. So I know that we will probably get Elizabeth Wilson, Representative Elizabeth Wilson, to one of our upcoming ones, if not April and May. She has revived, I didn't include that in my list, I don't know why. She revived the direct care worker, direct care professional tax, income tax bill. It would basically make wages of a direct support professional state tax free of state taxes. So you would not be taxed by the state on income earned as a direct care provider. That bill, Senate file or House File 295 and Senate File 7 are kind of getting a resurgence. I don't think it's going to be enough to pass, but we have heard that Representative Bobby Kaufman is going to allow it to come out of the Ways and Means Committee, and that there will be a hearing on the Senate side as well. So there is some movement on there. So we asked her to come on and maybe talk a little bit about that bill from her perspective. So we might, for those of you interested in that, we might have her come on, but I'd be interested in hearing from others if there are other people we can invite to speak on these in our next April or May Capitol chat that might be of interest to you guys. If you have any thoughts, you can put them in the chat or just go ahead and jump in. And also Jordan asked if is anyone aware of people receiving consumer choice option CCO through the HCBS waiver, having issues with financial management services not registering them for tax permits. I've not heard anything. Have you heard anything, Carlin, on that?
No, I haven't, but we can look into it.
Yeah, we can. Why don't we look into that? And we can, yeah, we can talk to HHS about that too and see if there's something they're hearing on that front. Any other thoughts? I will go back to the. Thanks, Jordan. We'll do that. Save.
Hey, Amy, this is Heather Sievers. I'm jumping on late, but I've been getting some kind of worried voices coming forward, wondering more about the changes to the waiver platform. And do we have a plan to kind of chat through that as well and what people can kind of anticipate with changes? I know a lot of families on waivers or on wait lists are pretty concerned, just maybe not knowing really what to expect.
I don't have an update on that, but I've been siloed in the legislature. So, Carlin, do you have thoughts about that? We can definitely look and see if there's a possibility of bringing someone on to talk about that in our next Capitol chat.
Yeah, we know in their time frame, they're still in planning process. The implementation is not expected for another year. So yeah, it's been quiet, but let's poke them a little bit and see what we can find.
Good point. Well, I'm going to go back and share my screen again, but feel free to jump on here with any thoughts you have. And we will do that. Believe it or not, we have, oops, get back on. Believe it or not, this week was the first day to request a mail-in ballot for the primary election. So you can now, if you want to vote by mail at home, and mail in your ballot, you can do that start now beginning March 26th to request that. And so you can fill out that request online or send it into your county auditor office. There's a form that you fill out, and they will begin mailing those out on May 15th. So that is the first day that you can start early voting by mail or in person for the June primary, which is June 4th. And the in-person one is either at a satellite center that might be located in a library or somewhere in your community, or at the county auditor or election office in your county. So I do a lot of the in-person voting because sometimes I'll be downtown and I'll just stop in and go ahead and vote early. There is a pre-registration deadline. So if you are not registered to vote in the state, maybe you just turned 18, or you're new to the state, or you have never registered, you need to pre-register by May 20th. You can still register after that. You just have to bring a bunch of materials with you to prove that you live where you live and that you are who you are, and do that at the polls. But the May 20th is if you're not registered to vote, and you want to vote in the primary, you might want to do that before May 20th. It's also the last day to request a mail ballot. So those requests have to be in to the county auditors by 5 p.m. that day. And then the Monday before is the last day for in-person voting. And June 4th is the primary. So you can go vote at the polls from 7 a.m. to 8 p.m. If you happen to have an absentee ballot in your possession, you need to take it down to the auditor's office before the polls close at 8. So can't drop it in the mail then. It all has to be received by the end of the day when the polls close on June 4th. So since that deadline was snuck up on us, that June seems a long way away. But we're now in that season for primary voting. So you might have a primary in your area, you might not, but just might want to be ready in case you want to vote. So I mentioned earlier the resources. So this week our bill of the week is on the assistance animal bill. And so that is, well, I just noticed we had a few edits on this one and I put the wrong picture up, but we just moved a couple sentences around. So there is actually a more current version of this up on our website right now. And I was going to go ahead and play the capital snapshot from this week on assistance animals since we're here. So I'll do that. Hopefully, if you can't hear it, let me know.
Hi there, this is Chloe Geyer. For this week's capital snapshot, we talked to Representative Heather Mackman.
Is it captioned?
2268. This bill describes when and how landlords can deny reasonable accommodations for certain animals.
All right. Well, first of all, thanks for having me on Capital Snapshot. I'm happy to talk a little bit about Senate File 2268 regarding service animals and assistance animals. And I think overall, the bill, when it came to us, was setting a good framework for renters and landlords, but I still had a few concerns about how service animals and assistance animals were lumped together in one group. And so Representative Turek and I got together to get a new amendment that would really separate the two out while at the same time showing how important both are for Iowans with disabilities. So that's the number one thing that we were able to get accomplished with our amendment, because of course service animals are highly trained, and so we wanted to be able to distinguish between the two. And then the other thing that I had a concern about was how within the bill there's a 30-day requirement for Iowans to have a relationship with a medical provider, and that's just not realistic in a lot of ways. Unfortunately, I was not able to get that requirement taken out, but what we were able to do was reach a bipartisan compromise to say that, okay, we've got the 30 days, we need to make sure that that medical provider does not have to be in the state of Iowa. And that is especially important for folks who are just moving into the state, as well as Iowans who live in border communities, and maybe their regular provider is actually, in another state. And so being able to get that done made the bill that much better. Now, there are certainly things that I would have loved to see taken out that I still think are not the best for Iowans with disabilities when it comes to assistance animals, but we were able to dramatically improve the bill and make it a bipartisan compromise. And for that, I'm happy to do it.
So we do those every week. They're usually 2 minutes-ish long. And they are on our website too under I didn't put it up there, but under snapshots. Yeah, they're capital snapshots. And we've done those on various bills, but they're also on our YouTube channel if you or it's easier to find them in that way. But of interesting note, Representative Heather Matson there used to be the bill tracker for the DD Council. She did all of the bill tracking for us prior to running for office. So a little connection there as well. Let's see, we have something in the chat. Yes, so our interpreter asked if our capital chats were captioned, and they are. I'm not sure why this one wasn't. I always go through and clean up the captions that they automatically generate. So I did that last night. So, oh, Jordan says he sees the captions right now. It just wasn't on my screen. Yes, all of them are captioned though. So I think that's all I had. Does anybody have any other thoughts, questions, topics, wishes, concerns? Those are our next 2 that we have scheduled. So the May 31st is after Memorial Day. It's not Memorial Day weekend. So we moved it, make sure we're not interfering with that. Harlan, do you have other thoughts you want to talk about?
Well, I could just share one thing that might inspire you in your advocacy efforts, and it's back to the animal assistance bill. Amy and I were in a subcommittee one day listening to a bill that we didn't really know much about, so we went to get information on it, and it did affect the disability community, but we weren't sure how, because it kind of came out of the blue and just a subcommittee came up one day. And while we were listening to the discussion from the legislators, one of the legislators said, "Hey, have we contacted anybody in the disability community to see how this affects them?" And we were like, well, we can help with that. But, it was just one of those times when you think, hey, this seems like the obvious thing to do, to reach out and contact the people who are going to be affected by these policies that they're putting forward. And it doesn't always happen. At least they brought it up the question there. We were able to get them some contacts, and then we were, more on top of what they were trying to get accomplished with this bill too. With the service animal bill, and probably because Heather Matson is very familiar with us, she was on the subcommittee for this bill, and she reached out and said, "I really want to know how this is going to affect people who have service animals, and what we can do to make this bill better." So it was, a time where you could see that a legislator who really cared about the impact and did her research and wanted to know more, did reach out. So it speaks well to building relationships with their legislator. And being in a position of expertise where they can reach out to you and hopefully ask questions about how the policies that they're working on might affect people in the disability community. We know that happened with the AEA bill, but we had so many advocates reaching out directly to them that they were getting educated, and at the same time having dialogue about the implications of those policies. So always feel free to reach out to your legislators, build that relationship, and get your name in front of them any way you can, whether you're following them on Facebook, asking them questions that way through email, because your questions and your attention to details are what affect the community as a whole. So be inspired, and thank you for your efforts, because we know that you all are doing good advocacy out there, and we can hear some of it. So please reach out if there's more than we can do to help with that.
All right, well, I guess we're gonna wrap up a few minutes early, which is fun once in a while, right? Looks like a nice day out, so hopefully everybody gets out and gets some fresh air. Thanks for coming. Next Capital Chat maybe after session, so we'll talk to you soon.
Thanks, everyone.
Happy Easter.
Happy Easter. Have a good weekend.
You too.
Thank you.
Thanks, Donna.
Welcome.